Hi, everyone. My name is Steve Thomas. I'm an associate professor and department chair of the Department of Exercise Science at Thomas Jefferson University in Philadelphia, Pennsylvania. I'm just here to tell you a little bit about the research that I do, some of the findings we've been coming up with recently in some recent studies, and also to share a training tool with you that I think really fills a lot of gaps for the baseball player. So my research centers on studying chronic adaptations in baseball players, really centered around injury. But as we know, uh, preventing injuries and maximizing performance really go hand in hand. So the research I do, one aspect of it is studying the neuromuscular control adaptations in baseball players. And this is one thing that I see very commonly, and a big reason why baseball players often get hurt is because they have neuromuscular control deficits. And it's not just at their shoulder, scapular area, it's throughout their whole body. We see a lot of core deficits. We see a lot of hip and pelvis deficits. We could even see neuromuscular control deficits in the ankle, balance type deficits. So these deficits really do kind of lead you down a road where you're going to be at a higher risk of injury, but also inhibit your performance. So some of the research we started looking into using EMG is what's called muscle synergies. And what this is essentially the theory is based on that your brain, your central nervous system, organizes all movement into what we call synergies. And what these are groupings of muscle that are, when you activate this grouping of muscles that are weighted in certain ways, and you string all these different synergies together, you could create any kind of movement possible. It's like having a bunch of Legos, all different shapes Legos. If you have enough of them and you construct them together in the right way, you can essentially build anything. So the same type of way, if you kind of merge all of these synergies, individual synergies together and time them right, you could create any movement throughout your body. So this really simplifies movement from a central nervous system perspective. And what we see is that when you're skilled in a task, your central nervous system will adapt and reduce the numbers of synergies that it has to produce that movement or that task. When you're untrained, you have a lot of synergies. And if we think about that, that makes a lot of sense, right? So when you're unskilled in something, you really have to think about how to conduct that movement to try to be successful at it. As you get better and better and more skilled and you adapt over time, it's not thought, there's no thought involved, right? It just happens. You don't even have to think about it. So that's kind of the aspect of this. And when we look at this, we see in baseball players that there's adaptations that happen side to side. So on their throwing side versus their non-throwing side. So we see within that same individual, from one limb to the next, from the stress of throwing, that there are these changes in the synergy structure. We see certain muscles getting highlighted more or used more. And some of these muscles, like the lower trap and the serratus, are muscles that we know get some fatigue and some overuse. And that's another aspect of all this is within neuromuscular control is also fatigue and strength, right? They all kind of merge together. We've also found that when we fatigue specific muscles like the external rotators of the shoulder, that we get different changes in our synergies as well. Certain synergies become more prominent to try to fill that gap of not having the external rotators. So we see some of these adaptations that occur. And we're still conducting research. We still want to look into the role that injury or pain play. But our hypothesis is essentially that when you get injured, it's similar to being untrained, that your central nervous system is now going to expand the number of synergies available, making your thought process in that movement more challenging, right? So we're going to think about it more. It's going to be a little more difficult when we get down to that kind of chronic injury state, as opposed to having the small number of synergies where we don't have to think anymore. So that's our kind of working hypothesis. So within baseball players, this is a big challenge of how do we train the neuromuscular system to function appropriately? How do we get it back to a healthy state? And one tool that has recently come out that I'm really enjoying, and I'm seeing more and more how applicable it is in baseball and how important it is for baseball players, is AXIO Centripetal Training. So it's a circular device. It has a sphere and a rubber tube. And as you rotate this, you get the sphere rotating. And as the speed increases, we get centripetal force. And the velocity of that rotation will dictate how much centripetal force. And the great thing about this is that it could occur in any of that 360-degree circle. So the perturbations you get are very random, powerful, especially as you spin it faster, and it's really it's infinite direction. So if we position our shoulder or body certain ways, these perturbations are going to occur in essentially any direction. Much different than a shoulder tube or a body blade, that the perturbations are very linear and predictable. So that's one of the places where I see other products, in AXIO really separating is, how these perturbations are occurring, how powerful they are, and how random and how unpredictable they are. And the nice thing about AXIO is it's small. You could travel with it. You could use it in the dugout, right on the field, really easy to take with you. And it really is not just for the shoulder or the upper extremity, but for the whole body. It's used to enhance balance. It's used for core control, for pelvic control. You get this added benefit of strength and endurance as well. So there's different stages of AXIO with more spheres and more weight. So the perturbations are even stronger. The demand on your neuromuscular control system is even greater. So, you have that ability to really kind of work up in levels of difficulty. And the longer duration of the rotations that you could maintain, it works on endurance as well. But I really think it gets to the center of this muscle synergy adaptation, and it's working your neuromuscular system in the way that it's supposed to. It's more of a reactive kind of muscle contraction. And that's how we typically will get injured, right? Is there's some type of perturbation that occurs, right? We have to react to it. We have to keep our joints stable, right? We have to have that neuromuscular control to, maintain our stability throughout our body in every joint. So AXIO is creating those perturbations and allowing your neuromuscular system to train reactively and really coordinate together, have all these muscles coordinate together in the right way to maintain that integrity of joints, of whole body segments, of centers of mass. So it's a really useful tool. I think it's going to really enhance performance in addition to keeping athletes healthy. And the many ways you can use it are really endless, right? And except for your creativity or your imagination, you could really use it in many, many different ways. And we've created warm-up routines, we've created training exercises. So there's a lot of ways to really utilize this as an athlete, as a baseball player. But I truly believe this is a device that has great use for baseball players. I really think it's going to help a lot of players stay healthy and stay on peak performance moving forward, and hopefully, prevent a lot of the injuries that we see in baseball. So check it out, try it out, get your hands on it. It's tough to describe until you really feel it, but you're not going to be disappointed. Thank you.